Sir, as general public, I mean antibiotics kon janiche ba suniche, but what is antimicrobial?
Actually, antibiotics means which act against bacteria. Antimicrobial is it consists a big array. That is, it includes antiviral, antifungal, anti-helminth, anti-protozoal, all these things known as antimicrobial,
Okay.
including bacteria. So that is known as antimicrobial, and only bacteria is known as antibiotic.
So the difference is that only, biotics and antimicrobial. Okay, sir. So what is, I mean, jodi kotha ba types of antibiotic therapy, sir, seta kon asibo?
Actually, the types of antibiotic therapy, there are three types of antibiotic therapy. One is a empirical antibiotic therapy, another one is a definitive antibiotic therapy, and third one is a prophylactic antibiotic therapy. So what is empirical antibiotic therapy? Empirical antibiotic therapy, suppose, say for example, a patient comes to our hospital. He doesn't have a culture report.
Culture report.
So we have to choose an antibiotic and give it to him so that it works. And empirical antibiotic therapy consists of not prescribing a very high grade antibiotic therapy, but it depends again on the patient's stratification. If the patient is young, non-diabetic, non-hypertensive and with a mild infection, then we should choose a very low antibiotic. If the patient is a middle-aged patient with little comorbid condition like diabetes or hypertension, but can be treated properly, a moderate amount of antibiotic to be given. And if the patient has taken antibiotic in last 3 months, we have to take a history of the antibiotic therapy in last 3 months, and having multiple comorbid condition, in a very difficult situation the patient has come, we have to go higher antibiotic therapy. And prior to giving any antibiotic or antimicrobial, we have to take different types of cultures, send it to the laboratory, and after that only we should start antibiotic or antimicrobial, so that there won't be any hindrance in getting or developing any culture, right? So these are the things. So these are the three types of antibiotic therapy. So according to the antibiogram, there is antibiotic sensitivity available here in our hospital. We have antibiotic sensitivity available. Every year we come out with that, and according to that antibiotic therapy and patient stratification, we should give empirical antibiotic therapy.
Sir, antibiotics, I mean, over the counter bhi antibiotics.
Yeah, that is actually the resistance of antibiotic or antimicrobials. It is developing. It is not only a problem of our state or our organization or our country. It is worldwide problem, because overuse of antibiotic, unnecessary use of antibiotics. Suppose there is a viral infection and without any patient goes to
without
the OPD,
consultation,
goes to the any doctor, they see, okay, you have fever, you take ciprofloxacin or some antibiotic, without knowing if the viral fevers, even they are treated with antibiotics. So that is why we develop antibiotic resistance. Secondly, over the counter. If you have diarrhea, you go to the medicine shop, you ask for the antibiotic, and they give you, and you take for 2 days, and you get cured, and after that you stop it. So taking antibiotic in a proper dose for a proper period of time, it is very important. Even if you are admitted into the hospital, if the doctor prescribes to take it for 7 days, please take it for 7 days and not for 3 days, because you feel good.
Yes.
And after that you leave it.
So what happens if we leave it in 3 days and we don't complete the course in 7 days?
See, the thing is that once you are admitted into the hospital, or you go to a clinic, visit a clinic, or you start any antibiotic or antimicrobial, you take for 3 days, the organism, they die, right? But the disease is not treated properly.
Okay.
Fully.
Right.
So unless and until you totally complete the course, the disease is not cured. Again you will suffer.
Okay, maybe after months, but again.
After months, again it will recur. At that time it will be in a more dangerous form. and it will be registered to what antibiotic you are taking. And there are groups of antibiotics. If you classify antibiotics, there is a huge classification. I am not going into that. But there are groups of antibiotics. If you take those antibiotics for at least 5 days or 7 days, then they develop resistance to other antibiotics also. So it is a very complicated thing.
So as we have seen like earlier also कि जदि जतले हमें यूरिन कल्चर पे स्पेसिफिकली जतले दिया जाए डॉक्टर्स से कि कल्चर दबा पूर्व माने कल्चर दबा पूर्व एंटीबायोटिक्स खाई नथि बजते तो सही तरह सर जाना पड़े जे को ये को रेजिस्टेंट हे जाई छि बॉडी को एंटीबायोटिक्स
हमर डेफिनेटिव एंटीबायोटिक थेरेपी जोटा आछि सेटा आफ्टर यू गेट ए कल्चर रिपोर्ट सपोज ए पेशेंट इज ट्रीटेड विथ एम्पिरिकल एंटीबायोटिक थेरेपी एज आई टोल्ड now you have already sent the urine culture or blood culture or sputum culture. Once the culture report comes, you see that culture report and tally with your antibiotic what you have prescribed.
Okay.
If it is matching, it is fine. If the sensitivity pattern shows that what antibiotic you have given, even the lower antibiotic is sensitive, you should de-escalate.
Okay, dose manage karajwa.
No. You have to suppose, say for example, you have given a antibiotic of third generation,
right?
And if it is sensitive to normal norfloxacin or the first generation antibiotic, you should come down.
Okay.
To that antibiotic according to that culture report. That is not a definitive therapy.
Okay.
And if required, what antibiotic if you are giving and the patient is not responding and the culture report says that is resistant to that antibiotic, you can increase to go to the higher degree and hit hard. But once you hit hard, give higher antibiotic, then once the patient responds to it and patient is cured, then you should de-escalate and come down and give a lower kind of antibiotic.
Sir, another general लोगों को मन रहा था जे धरी नियंतु my body is already resistant to a higher antibiotic. तो is it so कि higher antibiotic रु तलो को आउ से गुड़ा कामो करिवनी ता तलो ये गुड़ा antibiotics रो ये गुड़ा
usually कामो करे नहीं. But the thing is that in that case, if required, if the patient is aged with multiple comorbid conditions in ICU, then we have to give higher antibiotic and try it, right? In combination, different combination of antibiotic and try it. Otherwise, if the patient has received a higher antibiotic and the patient is fine, it is better not to give him any antibiotic at least for 3 to 6 months, so that he will be sensitive to all the antibiotics.
Okay. Sir, are there any side effects of like higher antibiotics or
each antibiotic has their own side effects, right? So accordingly, we will choose and give the patient according to the disease specific antibiotic we should.
Sir, antibiotics पे बहुत जनो उनको allergies था कि से माने antibiotics नहीं पारंत नहीं. So तांको पे alternative कौन था?
Actually, whenever before prescribing any antibiotic, we have to take a history of allergy. So usually people they are either allergic to sulfonamides, sulfa group of drugs, or penicillin, cephalosporins. So in that case, we have to choose another set of group of antibiotic, and in bigger centers or in a indoor setting, we can desensitize those people. Say for example, one patient is suppose allergic to penicillin, but we have to give. There is no other chance. Allergic to cephalosporin, but we have to give. There is no other way of getting out of it. We have to desensitize it, giving in a small doses and keeping in a very controlled environment where we can monitor the patient. In small doses we can give and make the patient sensitive. The patient who is allergic to that medicine, in small doses that patient is relieved from that allergic reactions, and the patient can take that.
So sir, like before prescribing any antibiotic,
we have to take the
history has to
allergy.
be
Yes,
taken.
of course.